Mr. Werfel, you referenced the percentage of missed payments and fraud. I actually question the accuracy of those numbers because these are self-reported numbers. And as a businessman, I understand how those things can be skewed, particularly the statistics and the accuracy of those numbers. So I also believe in a checks and balance system, and especially when we're grasping accurate numbers for policy assumptions. Where entities like Congress, the American people, the CBO misled when calculating the cost of PPACA, or Obamacare as we know it, by using bad accounting methods.
I'm sorry, I'm not sure what your question is.
Let me reiterate. Were entities like Congress, the American people, and the CBO misled when calculating the cost of PPACA, which is Obamacare, utilizing bad accounting methods?
No, I don't think they were misled. I think one of the important things that we do when we report our financial reports and our estimates is we report with that all the assumptions that were made, and those assumptions can be challenged. This is a somewhat of a thick book, and it's thick because there are footnotes and alternative analyses and alternative presentations. And I think that what we have empowered is a situation where academics, think tanks, members of Congress, and GAO can debate these numbers and have a healthy dialogue about whether the estimates and the projections and the extrapolations that are being reported are valid. And hopefully, if there is enough information to challenge these numbers, then that debate will come to the fore. And that's really our job, and I consider that my mission at OMB is to make sure that whatever we're reporting, that our assumptions, our underlying assumptions are clear so that experts and others can fairly criticize them and hold them under a light and debate their reliability.
Well, it really becomes a he said, she said without an authority in the middle. And so with that said, how do you do the accountability for the new 68 nebulous discretionary grants as described in HHS policy?
I need a clarification on the question. How do we do the accounting of
How do you do accounting on the new 68 nebulously written discretionary grants as described in Health and Human Services policy in that bill? How do you account for that?
Well, it depends on what you're asking about those dollars. Are you asking about if the discretionary grants,
well, let's go for let's go
the
further.
Appropriation should be clear in terms of what its amounts are. The question then becomes what information about those dollars are you interested in understanding, and then I can talk more about how they might be accounted for.
Well, let me make more specifics. It says can use such sums as necessary. How do you do accounting for that?
Well, the accounting statements that we are reporting on today, for the most part, look backwards at what the agencies spent. And so we have financial systems, automated systems that help us track which money from HHS goes to which grantee, and we can tell you on almost to a daily basis exactly how much money has gone out the door. If you're asking how much would be spent in the future by a particular grantee, that's not something that we estimate in the financial statements. They're considered an appropriation that would be looked at in the budget, but predicting how much of that appropriation would be spent is not something that I'm aware we put a report out.
So you couldn't score it?
Well, you could certainly look at, if it's an appropriated amount, you could certainly understand what the limit is. You can't go above the appropriated amount. So you would know, you would know the ceiling, but you might not know where you might fall under that ceiling.
But by definition, it says such sums necessary. And I want to take it down to the provider level. You can skew numbers any which way. For example, in dialysis, we're actually withholding payment from dialysis patients to show better numbers, on self-reporting numbers. This is where the fraud is, and we can't even get a grip on this. What we need to be able to do is have numbers that are apples to apples for comparison. And if Congress can't get this, neither can the American people. And we can't even look at what agencies look at. And this is just the tip of the iceberg. So I question even the reality of what these numbers actually are. You understand my frustration here?
In the area of Medicare fraud and improper payments, I could not agree with you more. We have a significant problem, an estimate that exceeds $60 billion, and it's unacceptable. I can sit here today and tell you that the error rates are trending down, but I can't say that we're at an acceptable level. So I completely agree with your frustration.
And it's not just those missed payments. It's also misuse from the agency itself in not paying out providers and hospitals and patients. It's on the same aspect. It's not just missed payments. It's withholding of payments.
Well, now you're venturing into a programmatic area that I don't have familiarity with, so I apologize.